has to be live streamed.
Priyanka ji, can you please make it live, live stream?
Done, sir.
Done? It
Okay,
is already live streamed?
Yes, sir.
Achha. I did not see. Okay. Oh, it will come as two, like previous session and this session will be under one video.
No. Separate videos only.
Separate video. But here it
Yeah.
doesn't show anywhere it is live streaming. Oh, it is there showing YouTube. Okay, fine. Okay, got it. Fine. So today we will okay, so we'll go through a question paper. Before that, there was one question, no, which was being asked. Shall I take that up of Ayurvedic acupressure? Should I take it up or just get into Chinese?
Yes, sir. You take it first.
So a little bit of Ayurvedic acupressure before we get into TCM. So it is very simple. You understand this opposite flow and normal flow. So we have like take this as a circle. Okay. So if this is the front of your palm and this is the back. So 0 will come here. Okay. 0 and 9 will come here. Okay. And what are the combination? Like maximum number is 9. Which all combinations will give you 9? Okay. 0 plus 9 is equal to 9. Right? 1 plus 8 is equal to 9. 2 plus 7 is equal to 9. Okay. 3 plus 6 is equal to 9. And 4 plus 5 is equal to 9. Right? There are 5 combinations. Okay, any other combinations gives 9? No, right? Within 0 to 9? No. Okay, so it will be always, if one number is coming, its corresponding number will come on the back side. Okay, if this is 1 and here will be 2 and here will be 3. Say 2 will be slightly. So you divide this equally. Okay, so this will be, so this will be 1 and this will be 2 and this will be 3 and once again this will be 4. And where will be 5? 5 will be here and 6 will come on the other side and 7 will come on the side and 8 will come on this side. So it is all the numbers are placed in such a way that this plus this, the top, the back and the front, the top. So 9 plus 0 is equal to 9. 1 plus 8 is equal to 9. 4 plus 5 is equal to 9. 2 plus 7 is equal to 9. 3 plus 6 is equal to 9. And this is your yin yang border. Right? This is your yin yang border and there is no point which comes over there. Okay. So there are 5 numbers in the back and 5 numbers in the front. And it is done in such a way that the number which is front and back, when you add, it will be how much?
9.
It will be 9. Okay, this is normal flow. Right, this is normal flow. And what is opposite flow? What is opposite flow? So you switch the sides. 0 to wherever 0 is coming, put 9, and wherever 9 is coming, put 0. So all the numbers you switch. Whatever is in the front, you put it the back, right back, and whatever is in the back, you put exactly in the front. So wherever 0 is there, put 9, and wherever 9 it is there, put 0. And wherever 8 is there, put 1, and wherever 1 is there, put 8. Wherever 5 is there, put 4, and wherever 4 is there, put 5. And wherever 7 is there, put 2, and wherever 2 is there, put 7. Wherever 6 is there, put 3, and wherever 3 is there, put 6. And now you plot. So this is opposite flow. This is clear to everyone? Any
Yes,
question?
sir.
Huh?
Clear, sir.
Clear? Any question on this? Okay. Fine. So we will move to, so we'll take a question paper. Okay, you all are able to see the question paper. This is of 2025, Jan, June, the previous question paper. So it is, all of you would be aware, no? So there are two sections where there is short answers section and the other one is objective type. Okay. So what we'll take? We'll take short questions and then, okay, we'll take this. So you will have 6 and in that you will have to write only 4. Okay. And write about main functions of heart and symptoms of disorders of heart. So you will write it in terms of, say, the same question can come in BHB. And the same question can come in TCM. Exactly the same. Will the answer be the same? Now the same exact question can come in BHB section. Okay. Okay, instead of this DNA part, the same question can be put. And the same question can come in Ayurvedic acupressure also. Right? Without any change in any word. The same, right? About main functions of heart and symptoms of disorders of heart. Now, will the answer be the same in all the three or will it be different?
It will be different.
Different, sir.
Okay.
Uh,
This, yeah, go ahead.
From
How
the
will it-
TCM point of view, we have to write answers.
Okay. So if the question is in BHB, we will just write it will circulate the blood. Okay.
Yes.
But when it comes to TCM, we will write What all?
Energy flow of energy. Sorry.
What are the main functions of heart as per TCM? Hmm? It should come fast, fast, fast. Okay, first one, it will make sure that it circulates blood throughout the body. Hmm.
Sir, all the 5 elements has to be considered in this TCM.
No, as per TCM, what does the heart do? The first statement is as per allopathy. Okay. Even in TCM and even in Ayurveda, we say that. But that is where the similarity ends. Next, all the way that TCM sees is different. Hmm? That's all. Heart only does this. Circulate the
Heart
blood.
gives heat to
Heart
the
gives
body.
blood. Hmm.
Huh?
Heart gives heat to the body.
Uh, only heart gives heat to the body.
ब्लड ब्लड भी पूरे शरीर को देता है सर ऑक्सीडेटेड ब्लड
Hmm? You have to think like it
ब्लड
is very
सप्लाई
easy.
करता है
नहीं, वो तो it is taken. Apart from supplying blood, what else does the heart do? Hmm? It houses the. It houses the.
10.
Shen is called as.
Mind.
Heart
Hmm.
houses the mind, or mind resides in the heart as per TCM. Like if your mind is very unstable, it means that the energy of the heart is unstable. If the heart mind is stable, it means that the energy of the heart is stable. What all can make the energy of the heart unstable? That is a different question. Okay. And what else? The energy of the heart opens in. Tongue. Right? Liver opens in eye, kidney opens in ear, lungs opens in nose, heart opens in.
10. Yes.
Heart manages tongue. In brackets, speech.
सर बोर्ड इज नॉट विजिबल सर
Oh, sorry, board is not visible. Okay. What else? What else does it do? Heart houses the mind, hence it is the emperor. What else does the heart do? At this
हार्ट
speed, we'll.
कंट्रोल्स द स्वेट
Yes, good. And what else?
Emotions as well. Emotion.
All the organ controls emotions. Its own emotions.
Mhm.
Hmm? So heart controls sweating. And what else? Heart, the color and appearance of the face depicts the condition of heart. Okay, the color and appearance of the face.
Heart is responsible for sleep also, no?
Pardon? Repeat it.
Sleep also, heart is responsible, no? Heart.
One of the organ responsible for sleep is heart. It is not, liver also manages sleep. Like if liver blood becomes less, then there will be insomnia. Liver fire becomes more, there will be insomnia. Kidney also influences sleep. Spleen influences sleep. So multiple organs influence, and one of the organ which influences is heart. Okay. Color and appearance of face. And what else does it do? It controls arteries and veins.
Nourishes all organs.
Hmm?
Nourishes all organs.
Through blood.
Through
Okay.
blood,
If we
yes.
say through blood, it is fine. But if it is through oxygen, it will be lungs. If it is through nutrient,
Yes.
it will be spleen. If it is through water, it will be kidney.
Okay.
If it is through other chemicals, it will be liver. Right? So these are all the main functions of the heart as per TCM. And what does the question ask? What are the diseases related to heart? Difficult to write? And symptoms of disorders of heart. What are the symptoms of disorder of heart?
Anxiety, insomnia, palpitation.
Palpitations. First thing you can write palpitations.
Palpitation.
And
Anxiety, insomnia,
breathlessness on exertion.
Yes, breathlessness.
Breathlessness on exertion. See, always the problem of heart comes when you do the activity.
Okay.
Right? When you do the activity, if you are having breathlessness,
Yes.
it is a symptom of heart. And when you are trying to do activity, you feel very tired. Feeling tired also involves the function of the heart. And third, there is speech problem. So there is
clarity of speech.
the if somebody is having, they can't pronounce the words properly, etc. Their speech, the tongue is not rolling properly, then it is
Stuttering sound.
Modulation of
Stuttering.
sound.
And like I'm forgetting the exact word.
Stuttering.
Stammering.
Stammering. So stammering, stuttering, all of those things comes under fixing. You will have to fix the heart. And you will see and you will notice very good results. Like somebody is stammering, you put the right points. Like in matter of minutes, you will see improvement.
Sir, if they won't speak,
If they are not speaking at all, then you will have to analyze a little bit more.
sound will be there, but the speech won't be there, sir. How?
You will have to analyze. Okay. So there can be involvement of pericardium. Say aphasia. They say there is no speech coming out. So if there is too much of chi in pericardium, then also say the pericardium is covering the heart. No, if it covers too tight, then the heart's functioning will be disturbed. Right? There should be some space between the heart and the pericardium. Okay, so if it is too tight, excess chi in the pericardium, then also the speech will be affected. There are few other situations where when there is emotional trauma, somebody has been traumatized emotionally, then also their speech kind of stops. Okay. So all of you will have to assess, is it an excess condition, deficient condition? Based on all of those things, you can come up. Okay. And there is excess sweating, no sweating. That also you can put it in. And there is insomnia is one of the symptoms. Okay. Okay, so these are about the symptoms of the heart. Write symptoms and treatment of asthma due to heart Chi deficiency. What are the symptoms of asthma due to heart Chi deficiency? What did we discuss?
Breathlessness.
Breathlessness. Difficult to breathe.
It is partially correct.
Breathlessness on exertion.
Always. When you try to do some work, you walk or you do some work and then you get breathlessness, then it is associated with heart. You are sitting, simply you are not doing anything, but still you are feeling breathless. Then it is something to do with either kidney or lungs. Clear? That part is clear to everybody? Okay.
Yes, sir.
So book will give more details. So this is the main symptom. What is oliguria? And write note about causes of oliguria. Alpa mutrata, less urine. What are the symptoms? When does the urine become less?
When kidney in deficiency, sir.
Water is, urine is like fluid, right? We can consider it yin. So the yin is becoming less. The fluid is becoming less. The yin is becoming less. So in kidney, if the kidney yin is becoming less, then the urine is becoming less. Okay. And you will have to write a short note. If the urine is less means what? Its concentration will be more. Yes, no. If the urine is less means its concentration will be more. So how will be the color? It will be more
Dark yellow.
dark
yellow.
Dark yellow.
Or
Right?
red.
So these are some of the symptoms. It is logical, very simple. And apart from that, if there is any other yin deficiency, okay, liver yin deficiency, etc., that can also influence. Liver yin deficiency influences kidney yin deficiency, and kidney yin deficiency influences liver yin deficiency. Right? It is a circle. What is hypertension? And write some symptoms of liver fire causing hypertension. What is hypertension? What is hypertension?
The high blood pressure.
High blood pressure.
High blood pressure, in another word, is called as hypertension. Why will be the hypertension happen? If the liver fire is more, we had discussed this in the heart chapter.
Or deficiency of kidney yin.
No. This is a excess type, right?
Stagnation of cold in liver.
No, the question is liver fire.
Okay.
So if the fire is more, then there will be heat will be more, isn't it? So we had discussed this. So if the tank, if you see, if the tank becomes hot, what will happen to the water in the tank?
It will be
We
hot.
had written, no? Liver is the blood tank. And if this tank becomes hot, and I had written this picture. If the water is hot, what will happen to the pressure on the container? The pressure will
Increases.
be more pressure on the container, right? Yes, no,
Yes.
Yes, sir.
right? See, this is artery and hot blood is flowing in the arteries. What will happen? The pressure will be more. Is it making sense? No sense.
Yes, sir.
Then why nobody is answering? So if there is normal blood flowing, then the pressure will be one type. But if the hot blood is flowing, then the pressure will be of another type. So which will have more pressure?
Hot.
Hot
Hot
one.
blood will have higher pressure. So when the liver, which is holding the blood, that becomes hot, then the blood which is coming into the arteries will also be hot. So that will increase the pressure, and you will have to write the symptoms of the
Heart fireplace.
liver fire causing hypertension. So what are the symptoms?
Anger,
Anger. Is it only anger?
with red eyes.
Red eyes? No. Anger which comes down slowly is liver anger. Anger which comes down fast is
Gallbladder.
heart anger.
Heart anger.
Right? If somebody gets angry and very shortly they'll become cool, then the anger is of heart. But once they get angry, lot of destruction happens, and it takes lot of time to calm down, like days, weeks. Then it is liver. Okay, and when there is heat in liver, what do? They
Drink lot of water by gulping.
gulping. Like once they raise the bottle, like half the bottle they'll finish and then they keep the bottle. It's like they gulp the water. Okay. And the eyes may be reddish. Okay. So these are some of the symptoms related to liver fire. And the sleep will be disturbed if there is a lot of fire. Okay. If imagine, okay, to make you understand, I'm giving you this example. So we have liver. So liver is the mother of heart. Okay. So there is more fire here, then the fire will also get transferred to heart. Right? Yes, no?
Yes, sir.
Yes, sir.
It will go to, from mother, it will go to son also. Now, what is there in the heart? What is there in the heart?
Fire.
Mind. As per TCM, mind's place, where does it stay? It stays in the heart. Now, somebody wants to sleep. Somebody wants to sleep. How should be? How should be the surrounding?
Mind.
Calm and cool.
Calm.
Yes.
Yes.
Now, if somebody puts fire and try to make them sleep, Will they be able to sleep?
Not possible.
Huh?
Not possible.
Under your mattress, if there is heat coming, will you be able to sleep? What will
No.
you be? The person will be, how restful this person will be? This person will be
Restless.
Yes.
restless because too much of fire is happening. Right? Now, the same is happening to the mind. So if there is more fire here, that fire will go into the heart and then it will be sleeping on a hot tawa, something like that. You imagine. The sleep will not come. So the mind will be active. Now this heat will be calmed by the night, deep night, not at the early night. So 12, 1, 2, 3, deep night when it is there, night is cold, right? So that coldness will calm this mind. Slowly it will calm the heat. And then the mind gets into the sleep. You understood the logic? Everybody understood it?
Yes, sir.
One person said yes, so others have not understood.
Yes, sir. Yes, sir.
Very difficult to say even yes, no. It only says that people are not in front of the system and they are doing multitasking, cooking, eating, doing something else. Acha. What is sore throat? Write about chronic sore throat. What is sore throat? Instead of me giving the answer, we will take the answer from Sir's book 91, page number 91. Sir says that there are 4 types of sore throat. Okay. Any morbid or painful affection of throat is called as sore throat. Okay. Pain, soreness, rawness, burning or discomfort in the throat are symptoms of different viral and bacterial infections. It can occur in people of all ages. Generally, there are 2 reasons for sore throat: tonsillitis and pharyngitis. There are 4 types of sore throat: full heat type, empty heat type, chronic sore throat, and occasional sore throat due to change of season and infection. Okay. So these are the few things which you can write about the sore throat. Okay. And write the symptoms and treatment of humid heat in urinary bladder. What are the symptoms? Humid heat symptoms. Burning
sensation in
burning and itching in the genital area, and pain experienced during passing the urine, or burning experienced during the urine, or when the urine is not flowing fully, it is stuck, difficulty during urination, and itching. Okay, these are the main symptoms of the humid heat in urinary bladder. And what is the treatment? You will have to write the points. For the humid heat in UV points, you will have to write. Okay. Clear? And why does this happen? This happens because of any infection in the urinary tract. And generally it happens more in women. And this which situation will give rise to this humid heat in your urinary bladder?
In diabetic patients.
And if there is lot of heat, will the bacteria survive? No. So,
Using
huh? It will
using
not survive, right? See, that is the mechanism which the body uses. If there is any viral bacterial infection, the body rises the temperature to kill it. But it means that in high temperatures, the bacteria don't survive. But in low temperatures, bacteria survive. Right? So it means that whenever there is yang in the body, the heat becomes less. The kidney yang becomes less. So what happens? It gives a ideal condition for the bacteria to multiply. So whenever the kidney yang or any other form of yang is less or kidney chi is less, then the infection becomes more often. So first you will have to treat humid heat and then you will have to treat kidney yang or kidney chi. Clear? Makes
Yes.
sense? How many of
Yes.
you did not understand this?
Yes, sir, understand.
Understood, sir.
Acha. Okay. Okay, next, the objective questions. Right. So here, hematuria. What is hematuria? Heme means heme means
Blood in urea.
blood. Heme means blood. Urea means urine. Means blood in urine is called as hematuria. When can this happen? Blood in urine, when can it happen?
Kidney
Excess
kidney
heat.
stones.
Heat in blood.
When there
Kidney
is
stone.
excess, in the
Excess
given
heat.
options, when there is excess heat in blood,
Heat in blood.
it will ooze out from the capillaries and get through urine it will come out. So when there is heat in blood, it will happen. Okay. And a loud and explosive cough indicates,
Excess condition.
isn't it? A loud and explosive cough indicates
Excess condition, sir.
loud means it will be excess. So it is an excess condition. Red eyes with red face. Red eyes with red face indicates
Liver fire.
Liver
Liver
fire.
fire.
means eyes is red because the fire is there in the liver,
Is
and that liver fire is also getting transferred to heart. That is where the
heart.
face is
Red
also becoming
face.
red. So it is liver fire. Okay. Painful burning urination may be due to
Heat.
burning means heat.
Heat.
Some type of heat, either full, empty, humid heat, some type of heat only will create burning. Will cold create burning?
No.
No. Right? So whenever there is burning, it is some type of heat, either full heat, empty heat, humid heat, toxic heat, some kind of heat is there. So it is heat. Okay. Chronic diarrhea may be due to
Spleen.
chronic
Spleen.
diarrhea may be due to
Spleen.
right? Because it is managing the food, right? Severe headache with dizziness indicates,
Liver wind.
is it an
Liver
excess? This is excess condition or deficient condition,
Excess.
Excess.
right? Severe means excess. Headache and dizziness, it is an excess condition. Out of all these three, liver wind is the only one which is excess. Rest are deficiency. Lung chi deficiency, stomach chi deficiency. So it cannot be deficient. So it has to be liver, wind.
Wind.
Out of all the 3 subjects, TCM is the easiest to answer when it comes to objective. Why? Do you think it is? Do you think so?
Yes.
Why?
I can say that
Why?
because being a semester 1, I'm able to answer these.
Semester 1 you can answer.
Yeah.
See, the same questions, it can be given from semester 1 to semester 10. Even if you give from semester 1 to semester 10, it will not be like, even if you take semester 10 or semester 8 or 5, 4, 3, anything after second semester, the questions will be very similar. They cannot go out. Excess, deficient, heat, cold, liver, only those things will be there. So it is relatively quite easy. Once you have a strong hold on the fundamentals, all semester questions will be very similar. Okay. Poor appetite and fatigue may be due to
Spleen.
spleen. Appetite is food related. So it is, which is the organ which manages the food? Spleen. So spleen. Cough with body heat may be due to cough with body heat. May be due to
Wind heat.
Wind heat. Wind heat.
body heat is wind heat. See, it may start with cold, but later it will turn into heat. Anything, initially it may be cold, but anything which enters after a certain time, it will become heat. So it is wind heat. High BP with excess heartbeat will be treated by
H7.
S7.
right, H7. Because in heart fire blazing, which point is there? H7, 8, 9. Right, so it is H7. Reduced urine volume may be due to
Obstruction in urinary.
T excess.
Now,
Obstruction.
Obstruction in
excess.
urinary.
so it is, see, whenever there is extra cold, whenever there is extra cold, there will be excess urine or less urine.
Less.
excess, na cold conditions or
Excess.
excess?
So
Access.
whenever, see, some who in winters, you will notice that some people will pass more urine very frequently, because as the cold becomes more, as the evening starts, their frequency of urination will increase. Right?
Yes.
So the cold increases the flow of the urine. So if there is any obstruction in urinary bladder, then the volume will reduce. Okay. So what will happen? If there is an obstruction in urinary bladder, what will happen?
Tone.
There will be retention of urine.
There will be retention. Okay. Say, imagine there is 100 ml. I'm only giving you simple example. So under normal condition, so total urine, I will write it as 1000 ml. I'm trying to make it simple. So in a normal condition, if they pass urine, so every time it will be, say, 100 ml into 10 times. Okay, 100 ml into 10 times is equal to 1000 ml. If there is an obstruction in urinary bladder, what will happen? The flow of the urine will be reduced. So it will be, say, 50 ml. Urine will come, but kidney is producing 1000 ml. So how many times they will pass?
20.
So their frequency of urine will increase. Reduced volume and increased frequency. Clear?
Yes. Yes, sir.
Okay. So this is what happens in obstruction. If patient breathes with open mouth, it indicates
Deficient condition.
Deficient condition.
deficient. Okay, they are not able to pull through the nose, so they are breathing through the mouth. So it is a deficient condition. Dyspnea and tiredness may be due to
Heart की deficiency.
one moment.
Dyspnea.
Okay, shortness of breath. So it is due to, see, tiredness is excess condition or deficient condition?
Deficient.
Generally deficient. And dyspnea is shortness of breath. So this also generally is due to a deficient condition. So here there is only one deficient condition and others are excess. So I am trying to teach you in this way because sometimes even if you don't understand the problem, but based on the choice, if you are using common sense, you will get to know. So there is only one deficiency type, even if you don't know if it is because of heart, stomach, liver, or whatever, or kidney. So there is only one deficiency. So you can go ahead and tick the heart Chi deficiency option. Making sense?
Yes.
Yes, sir.
Okay. In college examinations, etc., this is the strategy people use, isn't it? Huh? So when in 4 you will have to choose one. To choose one, either you can use your knowledge or you can use your common sense to arrive, or third is just randomly toss and put. So if you don't have the exact knowledge, but still you can use elimination method to figure out a close probability of correct answer. Okay. Scanty urination indicates
Kidney deficiency.
we discussed.
Kidney
So, kidney indeficiency.
Indeficiency.
Shortness of breath while climbing stairs may be due to
Heart.
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 How more easy can it be? Okay. So it is deep colored urine may be due to,
Again, kidney deficiency.
yeah, see, the choices are so limited. So they have to change the same question, back and forth. So it is very easy. So if you understand why deep color comes, why does the deep color come in the urine? Because
Kidney indeficiency.
kidney indeficiency is correct.
Less urine.
Concentration is high.
The concentration of the
Urine
urine
is
is
high.
more, right? So that is why it is deep colored. Whole body edema indicates
Kidney yang deficiency.
Kidney.
the body is getting accumulated in the body. Sorry, water is getting accumulated in the body, and the organ which is supposed to send the water out, which is the kidney, that is functioning less. So the kidney yang deficiency. Polyuria indicates
Gout.
Diabetes.
Poly means multiple.
Diabetes.
Urea means urine.
Diabetes.
Excess urine indicates
Diabetes.
Diabetes.
there is too much sugar in the body and the body is trying to throw out the sugar. So that is why there is excess urination. Okay. Twisting and stabbing chest pain may be due to.
Stagnation of heart.
So it is the pain is where it is coming in the heart, in the chest. So out of all these organs, which is the one which is closest to the chest?
Heart.
Heart, right? Liver is not in the chest, kidney is not in the chest, only heart is in the chest, right? So are we using anything extraordinary medical knowledge here?
No, sir.
No.
We are using only common sense, is it not?
Yes.
Yes, sir.
So even though it is 5th semester, first sem students will also be able to answer it. And forget first sem, like common people will also be able to answer it. Okay. Thick, purulent cough indicates, means thick
Heat condition.
and
Cold
colored
condition.
cough.
Condition.
Thick and say greenish color is coming. When does it come? If there is excess
Heat.
heat. And if it is excess cold, it will be
White.
White.
white. Snow is cold, right? Snow is what color? White color.
Hmm.
So if it is white, it is indicating there is some kind of cold. So dry cough with dry sputum indicates
Lungs in deficiency.
Indeficiency.
in is reduced water. Indeficiency is reduced
Dry.
water.
Hmm.
When water gets reduced, what will happen? It will become dry,
Okay.
isn't it? Yes, no?
Yes, sir.
When water
Yes,
reduces,
sir.
things become dry. So that is when you get dry cough. So lungs in deficiency. Depression and insomnia may be due to
Heart.
Heart.
heart. This is the first option, but you cannot rule out the small intestine. Okay, because paired organ, right? So easiest is heart, but you treat heart and nothing is happening. So as a therapist, small intestine should not go out of your radar. Okay, you should always keep small intestine also in the radar. It controls blood and sweat.
Heart.
Heart. Why? Blood you will say easily because
Yes.
it flows through it. What about sweat? Why does heart control sweat?
Yeah. Because it produces heat.
On-
The heart is
They
firing.
add through lungs.
Why? So we get stuck, no? Whenever there is a why,
Yes, sir.
the train stops there.
ये वाई सिलेबस में से निकाल देना पड़ेगा सर.
नहीं लगाना पड़ेगा. We have to put why everywhere. Every sentence, every word, there should be a why.
तभी तो
Only then we will become a good therapist. Otherwise, it will be a
हाँ, बाकी तो इन्फॉर्मेशन है वो
Controlling
तभी
of
लॉजिक आएगा.
homeostasis, sir.
how.
सर हार्ट लंग्स को ची भेजता है वहां से वो डाउनवर्ड होके बॉडी में जाता है तब कुछ
Sweat can happen anywhere, no? No down, up.
Yes, sir. The circulation of blood is throughout the body.
So,
It maintains the heat of the body.
kidney doesn't
Almost.
maintain the heat. It gives water, right? Wherever there is excess heat, so it will supply water and cools it down. Hmm? How many of you are 5th and above semester students here? Ramashri and only one? 5th and above? Huh? Nobody asked this question to your teachers? Hmm? Should you know this or not know this?
आर्ची आर्ची ब्लड को भेजता है लंग्स पे और
Hmm?
नो
So should I discuss this or continue with other questions?
नो सर प्लीज डिस्कस
See, it is pores, right? Sweat is coming, like if this is skin, so these are pores. So if the sweat has to come out or does not have to come out. So if the sweat has to come out, see, this is my thinking. It is not in the book. Okay. Now don't ask me for from which book did you take. So it is in one book which is not written yet. Okay. So now the sweat is coming out. This is the sweat. Now in your tap, house tap, if the water has to come out, so the tap has to be open, right? If the tap is open, only then it will come. If the tap is closed, it will not come. So there is some kind of water control, right? So it is some kind of control is there. That control, open, close, open, close, open, close. Yes, the control is, what is the work? Open, close, open, close. This is what it does. It is a type of a valve. Can I say that it is a type of, this control is a type of valve? Type of valve function. What does that valve do? Open, close, open, close. That is what it does, right?
Yes.
So which organ in the body has maximum amount of valves?
Heart.
Heart.
Right? So heart has
Forward.
4 valves. So heart has maximum valves compared to other organs. Yes, no? Correct?
Yes. Correct. Agree.
So if the control of the pores has to be given to some organ, should it be given to an organ which has lot of valves or less valves?
Obvious lot of fun. Yes.
Huh? Whichever organ has more valves, it will be able to control the valve function of so many pores. Yes, no.
Yes.
Or should I give an organ that responsibility which has little less valves?
No, no.
Sir, lungs also having the holding capacity of the sweat, no?
No, lungs manages the skin. So this is managed by, skin is managed by lungs. But the pores valve function is managed by
Heart.
heart. Hmm? Making sense?
Yes.
Or it is totally not making any sense?
No.
Then,
Or it
sir,
is-
how to differentiate between the sweating because of the lung and the heart? Because both having the breathlessness is the main symptom, both having.
No, in the sense, when should we breathe? Sorry, when should we sweat?
So when
After
it increases in the
exercise,
body,
the lungs, heart is sweat.
When there is
When-
heat in the body.
When there
when
is
it
heat,
increases in the body.
right? Or when there is excess heat outside, to cool
exertion.
that heat, it has to open, right? So now
Hmm.
that opening and closing, I am trying to make you understand why it is heart. Now, can there be other type of sweating apart from what is being mentioned here?
जब heart attack और उसमें
Say one of the symptom of heart fire, stomach heat. What is that?
yes.
Huh?
On the head,
stomach.
sweating on the head.
So when they are eating food, the forehead will sweat. Now this is
Hmm.
linked to stomach heat. But here, what is the question? The question is general sweat. General sweat is controlled by
In the body. Mhm.
heart. General sweat of the body is controlled by heart. And why? Why? Why?
Due to increase in heat
I just explained.
when exertion or
Too many
The-
walls. Too many
the-
walls.
The control of the sweat is managed by heart because
Too many
the
walls.
pores flow and flow. No flow and flow is managed by a valve function, and heart has the maximum amount of valves. That is why the heart manages the sweating as per Krishnamurti. Okay. Now don't
yes.
go and say this to others, and they'll say which book. So every time when they ask this book, which book, you should say a book which is not written yet. Okay. Fine, clear. This part is clear.
यस सर सर
Yes, sir.
पर पोर्स को तो लंग्स गवर्न करते हैं सर लंग्स
Skin.
की वजह से
Skin is governed by lungs.
यस
But
But-
within the skin, there are pores.
इट इज डिफरेंट पोर्स को अलग
No, see, it is one or what did I write in the first day? Do you remember?
सर आज फर्स्ट टाइम ज्वाइन किया है सर सॉरी
Who is it? Anita Jain.
यस सर
Okay. So on the first day I wrote, you are in which semester, Anita Jain?
सर 6 कंप्लीट किया है सर
6th. So on this first day I wrote this figure. So in all organs, there is involvement of other organs function. Right?
ओके
So lungs is governing skin, but every aspect of skin is not governed by only lungs. The moisture
Right.
may be governed by lungs, but the
Kidney?
pores is
Yes.
managed by heart. So if there is excess sweaty, means sorry, excess oily skin, who is managing that oil?
Spleen.
Liver?
Spleen,
Liver or spleen?
spleen. Right? Humidity.
Spleen.
Oil is
Okay.
what? Humid. So that spleen and stomach is managing the oil on the skin. Heart is managing the opening and closing of the pores. But who is managing the water which is coming out?
Kidney.
Heart.
Kidney.
Yeah.
Water belongs to kidney.
Yes.
But how much water should flow or not flow? Control is
Heart.
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 Making sense?
Yes, sir.
Yes, sir.
Yes, sir.
It is still not a confident yes.
Yes, sir.
Yes, sir.
It is very, very shaky yes.
No. It's
Huh?
agreement on first lecture only.
It is? It is?
वो फर्स्ट लेक्चर में ही वो तो सर
First lecture में क्या?
उसमें ही
सर
एग्रीमेंट हो गया था सर
Agreement हो गया.
सर वो विजन नहीं बन पा रहा
Sir, your why is very logical.
Huh?
Your why is very logical.
Why is very logical. Yeah, it has to be logical. See, it is, you have to understand the TCM in this way only. Only then you will be able to diagnose. Otherwise, it will be very tough. Right? So I'll see, everything is there in every organ. Say now there is a cell. Imagine there is a cell. And cell has different functions. Cell has different functions. Right? So now who controls cell? As per TCM, anything that you take in the body, it is all managed by these 12 organs. Right? What are they? Heart, small intestine, liver, gallbladder, spleen, stomach, lungs, large intestine, kidney, UB, pericardium, and triple wormer. Only this. Anything that you take is managed by only this and nothing else. Either it could be your nerve, it could be your bone, it could be your hair, it could be your skin. Huh? Anything. Say you have nucleus and you have mitochondria. Okay. So you have other organelles which is there in the cell. There is intracellular fluid. So there is intracellular fluid and there is extracellular fluid. Okay. So even inside a cell, one organ manages one functions. Nucleus is probably managed by, say, 60% heart, 10% lungs, 10% spleen, etc. Mitochondria is managed by, say, 50% liver, 10% heart, 20% kidney, like that. So every tiny thing in the body. So you have eyes, right? Eyes is not entirely controlled by liver. So eyes, the sclera is managed by one organ. Sclera managed by say lungs, right? So you have pupil managed by one kidney, and you have retina inside, that is managed by one thing, but overall is governed by liver. Making sense? So similarly, if you take one hair, okay, the hair requires, so the roots are there. So roots are probably managed by kidney. Okay, I'm only giving you some examples. So let's say root is managed by spleen. Earth, right? Earth. So roots are in the earth. Okay, I'm giving you an example. I'm not. So there is black color. The hair color is black. So black color is associated with kidney. So kidney may be managing the color of the hair. And softness or thickness of the hair managed by lungs. Softness managed by who? Heart. I'm just giving you heart. And the growth of the hair, liver. I'm only giving you the example. The tree grows, so hair grows. So different aspect of one organ or one cell or one part of the human body is governed by the permutation and combination of the energies of so many of these 12 organs. Is it making more sense now? Now you have
Yes.
huh?
Yes, sir. Yes, sir.
Skin is
Yes,
there,
sir.
mainly managed by lungs. Pores, opening and closing. Pores, open and closing, managed by heart. Okay, and the sweat coming out of it, the sweat which comes out of it. Okay, sweat is managed by the liquid. I would say sweat, liquid
Kidney.
managed by kidney. Okay, the shine on the skin, the shine, probably heart. Oil on the skin,
Spleen.
spleen. Is it entering your understanding?
Yes, sir.
Yes, sir.
Yes, sir.
So now for everything you should have a answer to why. And that is where it is tough. The deeper you understand the subject, you will be able to come up with why. Okay. There is a certain level of depth to which the book can go. Right? Can it go to such deep thing? It cannot go. Unless the 24 treatises become 240 treatises. Right? So there should be one treatise for neuron, one treatise for nephron, one treatise for skin cell, one treatise for bone cell, one treatise for hair, right? One treatise for sweat. like it is, I don't know, even 240 treatises may not be sufficient, isn't it?
Yes, sir.
So let's go back to questions. So only this took so much of time. Sweat. Okay. Tip of tongue is red. It may be due to
Heart.
heart, because those were tongue diagnosis is taught to 5th sem. No, right? I think it is in 6th. Tongue diagnosis is covered or not? It is. I think it is in 6th sem, I believe.
No,
Seven.
sir.
Huh?
7th.
7th sem.
Seven.
Yeah.
Okay. So
Seven.
tip of the tongue is indicating the heart. Okay. Bitter taste in mouth may be due to.
Liver.
Liver.
So it is a partial answer. Okay. If the bitter taste is in the morning, it is heart.
Heart fire blessing.
Right, sir.
It is a heart. If the bitter taste is throughout the day, it is liver.
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 But here they have not given that segregation, so we will choose liver.
Liver.
What resides in the heart? The soul.
Mind.
Mind.
So where does the soul reside?
Pineal gland.
Huh?
Pituitary gland.
No, there is no
Pineal.
pituitary
Liver.
gland. There is no pituitary gland in TCM.
Liver.
Partial answer.
Liver.
Huh?
Ethereal soul in the liver.
Sir, no,
Corporeal soul in
none
the
आएगा sir, none.
No. Yeah, very good. Somebody was going. What is that?
ethereal soul in the
Uh-huh.
liver and lungs में corporeal soul.
Yeah. So in TCM, there is 2 types. One is corporeal, means worldly, and ethereal is non-worldly. And the non-worldly soul stays inside the liver, and the worldly thing stays in the lungs. Why? Once again,
Oxygen.
yes, very good. So lungs is one organ which is continuously connected to the world through the breath. Is it not? Continuously, it is a chain through which I am continuously connected to the outer world. It's because that is the only one which is entering continuously. So to connect to the outer world, the corporeal world, so the corporeal soul stays in the lungs. Okay. So not the soul, but the mind stays in the heart. Tongue is the opening of
Heart.
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 Excess dreams and night sweat may be due to
Heart fire blessing.
Heart indeficiency.
Heart
Heart
insufficiency.
insufficiency, sir.
Heart insufficiency.
Okay.
Now,
See, it is why heart insufficiency.
In
Why
is
did-
night, sir.
Yes.
In is
in
night.
deficiency, in night.
Yes.
Hmm.
Night means it is yin. Whenever the problem happens in the night, so it is something is related to yin.
In.
And if the problem happens in the morning, it is something related to
Yeah.
yang, right?
Hmm.
So it is the sweat is happening more in the night. So it is something related to yin. So, and there is only one yin. It is heart yin deficiency. Okay. Dry mouth and ulcers on tongue may be due to,
Excess heat.
Excess heat.
right? When there is too much of heat, it dries the mouth and it creates ulcers. This is also partial answer, but based on the option, if it is a red ulcer, it is excess heat. It is full heat. If it is a white ulcer, it is
Cold. Excess cold.
empty heat. Empty heat. Okay, white rimmed ulcers is empty heat. Red rimmed ulcers are full heat. Okay, but here there is no empty heat, full heat, only excess heat. So we will choose excess heat. Front shoe point of stomach is
CV12.
CV12.
12. Front shoe is something which will come in the front. CV12 is the front shoe point. Stuttering may be due to
Heart.
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 Right. Chalo, finished. Good. So we have another 12 minutes. Anybody wants to ask something or say something? Did you all enjoy the session?
Yes, sir.
Yes, sir.
Yes, sir.
What did you like?
And we want more classes
Huh?
after the exam.
After the exam, you want more classes? So there will, Ravindra sir has some plans.
Okay.
So the Yellow Emperor part 1, how many of you have joined Yellow Emperor part 1? So it has been fascinating because the depth in which Yellow Emperor is the like origin or the first textbook. Like for Ayurveda, Charak Samhita, Sushruta Samhita, they are all the original texts through which the entire system has been developed, right? Similarly, for acupressure or TCM, Yellow Emperor is the origin book through which all the other textbooks have come. So we are going through that. So after the examinations, we will start, and it will be like very in-depth understanding of the subject. Those who want to be good TCM-based therapists, so there is no option apart from understanding the Yellow Emperor properly. Okay, if you want to be really good. Okay, so those classes will be conducted after the examinations, and Ravindra sir will circulate the details. So I invite or suggest all of those who have not learned, studied, to study it, and you will get more classes also. Okay. Anything else? How many of you are new to my class here? Dinesh ji is new.
Yes, sir.
Which sem?
First sem, sir.
First sem. Okay. And
वो आपके एडवाइस पे ही मैंने ज्वाइन किया था.
अच्छा. Okay, very good. And somebody else?
So can I understand the difference in anger and yang anger?
Yang is anger is yang in nature. Anger is yang in nature, and being patient is yin in nature, right? So whenever the yin is less or the yang is more, the anger comes out. Okay. So yang anger is more, the intensity of the anger is higher in yang anger, and the intensity of anger is less in yin anger. Yin is patience and nurturing, soft, right? Because that is mixed in the anger. So it will be.
सब एक बोलते हैं कि ज्वालामुखी की तरह गुस्सा आया तुरंत हमने बोल
That is
दिया
yang anger.
और एक होता है अंदर ही दबा दबा करके रखना, फिर बाद में कभी जा करके वो
That is
ज्वालामुखी की
controlled. That is controlled
controlled
anger.
anger.
So that is yin anger.
That is in anger.
Controlled anger is more yin in nature, and uncontrolled is yang in.
Yeah. Okay. Thank you, sir.
Okay. Acha. Good. Fine. So if there are any.
So
see,
how
I have
treat in anger and yang anger? How treat?
Which sem, Anita Jain?
6.
6th. So you will have to see it is because of what? Is it excess heat in heart, excess heat in small intestine, excess heat in liver, excess heat in
Liver.
gallbladder?
Oh, right.
Reduced in, is it because of indeficiency? That person is becoming restless. So indeficiency in heart, indeficiency in kidney, indeficiency in liver, stomach. So all of these things are
Okay.
methods of treating anger.
Thank
Anybody
you, sir.
else? Any other question? We have another 8 minutes with us.
There is the 4 stages of diseases, na? At the key level, meridian level, blood and
Organ
nutrition
level.
level and
Yes.
Organ level.
Yes. These
so
are
how
the
it
different. How?
from key to how it travels from outside to inside, sir.
So
That
the
key and the
first level is,
electric
so what is on the outside of the body?
key flowing, defensive key.
Meridian. Meridian is the closest. It is just below the skin.
Skin.
Hmm. See, if somebody is not an expert, they have to work towards becoming an expert, right? So the meridian flows very close to the, just below the skin. And then it slowly goes deep into the organ. Okay. So we treat the one which is, so if the disease has to enter, it will be through the meridians. So first level of problem is at the meridian level, and generally it is easier to fix. Okay. And next is chi level. You can say chi. And third, blood level. Fourth is organ level. I may be wrong here. I may be wrong here. So the order is, the deeper you are going, the deeper the disease is entering, the harder the problem becomes to solve. Okay. So whichever is the earlier you figure it out and fix it, it becomes easier, right? So you will have to treat only one protocol if it is at the surface level. If it becomes deeper after this, then you will have to treat something else. The deeper it is going, then you will have to treat something else. And then you will have to treat something else. So it will be a chain of the different protocols that you will have to use. Okay. The deeper, the chronic the problem is, so different. So first protocol you will use for, say, 4 weeks. Then second protocol you will use for another 6 weeks. And third protocol for 2 months. And fourth protocol once again for 2 months. Fifth protocol for 3 months. So you are going in the opposite direction to fix it. Make sense?
Yes, sir.
Okay. Anybody else? We have another 4 minutes. Any question?
सर ये डिसाइड कई बार नहीं कर पाते कि किस लेवल पे, कि की लेवल पर है, ब्लड लेवल पर है। जैसे बीमारियां 6 लेवल्स की देखी जाती हैं, तो उसमें हम किस तरह से डिसाइड कर सकते हैं उस चीज को?
The first thing is not to get into the levels.
Okay.
First understand the symptoms. And you should be thorough in the patterns. What are the symptoms for each pattern? And out of all the patterns, you have to see, okay, this pattern is coming, so this organ, this energy, this level is involved. So to spot the pattern, you have to learn. That once you become strong, then you can get into the other levels.
Okay.
Okay, so I think, so we have just 3 minutes. So with this, I'll hand it over to Ravindra sir for any announcements.
Yeah.
And I wish a good, successful examination. And I hope to see all of you in the next semesters also. So over to Ravindra sir.
Thank you, sir.
Examination is only a stage. We'll pass this stage, the process of learning continues.
Ravindra sir's network is some issue. We can't hear, sir. There is some problem.
So somebody was asking about and explained it well. If you want for occupation, wherein Dr. Wole has brought. Oh, am I audible?
Now it is
Hello?
better, sir. Now it is better.
Hello?
Now it is
Am I
better.
audible?
Now better,
Yeah.
sir.
Yeah, friends. Yeah. If you want, you can refer treatise 3, wherein he has,
Voice is not clear,
explained
sir.
about phases of diseases, 6 stages of diseases, humoral stage 3 stages, cellular stage 3 stages. So you can correlate with what Krishnamurti said. See, in the days to come, we have a plan to conduct on electroacupressure also. Even our Samsthan is conducting 2 days workshop on electroacupressure. In that, it is very clearly explained the stages of diseases and what to treat in each stage. So it will be very beneficial to you. And we are also, Ishan is also planning to conduct lots of classes before the new semester starts in the holidays, so that you are properly empowered. And we are planning to the Yellow Emperor Classics, as explained by our Professor Krishnamurti sir. It is fundamental, it is the raw material of concepts. Except EOV and electroacupressure, everything is elaborately explained there with the original concept. You will understand. So it becomes easy to understand anything up to 10 semesters and beyond. You'll get a new, what you call insight. The two from Krishnamurti sir, you'll go deep into the matter. So anyhow, I wish all the best for all our students. Please join for the next semester after the examination, and try to get some new students so that the motto of our Samsthan to teach one, treat one, and reach one is fulfilled. And on behalf of all of you and on my personal behalf, I thank our beloved faculty Shri Lakshmana Krishnamurti sir for rendering one more captivating session. And this, as I said earlier, the process of learning will continue. I wish all the best to all the students. So thank you very much, friends. Goodbye. If you have any doubts, you can contact us through WhatsApp in all the Ishan groups. We'll try to clarify your doubts. Goodbye.
Thank you all. Good night.
Good night, sir. Thank you, sir.
Good night.
Good night, sir. Thank you.
Bye.
Thank you, sir. Good night.
Good night. Good night.
Good night.